we're getting very, very close to resolving to what has been probably one of the biggest obstacles to focus ultrasound companies getting their technology to patients. And I've always said that advocacy is a contact sport. You really can't sit on the sideline and wait for someone else to do it for you.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Advancing the adoption of focus ultrasound in medicine is a complex, multi-step journey, one that involves rigorous research, clinical trials, and constant technological innovation. But another critical part of that journey happens outside the lab through medical technology policy and advocacy. Organizations like AdvaMed, the Advanced Medical Technology Association, play a vital role in this process. Representing more than 600 member companies worldwide and organizations like the Focus Ultrasound Foundation, AdvaMed collaborates on advocacy initiatives to improve reimbursement, increase awareness among policymakers, and champion legislation that accelerates patient access to life-saving innovations. We're joined by Patrick Hope, Executive Director of AdvaMed's Medical Imaging Division. Patrick brings a wealth of experience in health policy and imaging advocacy and is here to share how AdvaMed is working behind the scenes to ensure that innovation in imaging and in focus ultrasound translates to real-world patient access and impact. Welcome to the podcast, Patrick.
Thanks for having me.
Before we talk about AdvaMed, can you tell us about your background and how you got involved in policy work?
I worked on Capitol Hill in the mid-90s, which was a very interesting time. Bill Clinton was elected, and they were trying to create health care for all. And so I did that for about 7 years, leading healthcare policy in congressional offices, very steeped in all the facets of healthcare. And then after that, I went to spent about 15 years as a lobbyist and counsel for physician specialty societies, primary care and cardiology, where I learned a lot about physician payment, hospital payment, and overall advocacy as a lobbyist representing physicians. And I've been with the medical imaging industry now for a little over 10 years.
That's amazing. And can you briefly explain what kind of work AdvaMed does and its core mission?
At its core, AdvaMed is an advocacy organization for the medtech industry. And that means, of course, engaging with state and federal policymakers. We're in and out of state houses across the country, Congress, meeting with members of Congress, Republicans, Democrats, members House and Senate, federal agencies, FDA, CMS, and other agencies, and of course the White House. Now, for our members, MedTech is reshaping the future of healthcare, advancing early detection and treatments, which is relevant for focus ultrasound, accelerating recovery, and enhancing quality of life. And now these innovations are making a very real difference for millions of patients. Our mission at AdvaMed is to support getting these life-saving and life-improving technologies to patients as quickly as possible.
And you lead the medical imaging division of AdvaMed. What are your top priorities in this role?
We do a lot of different things, but there are 3 priorities that say top tier. One is what we call digital health technology in medical imaging, and that includes artificial intelligence and cybersecurity issues. The second thing that we do is patient safety through medical device servicing. We want to ensure that anyone that is servicing an MR or CT or X-ray has the same level of quality training that the manufacturer has, and make sure that they report advocacy events. There are so many people out there that are servicing our devices that don't have that same level of training. And I would think as a patient, you would want to make sure that whoever is fixing and updating, patching, and cybersecurity and whatnot has that same level of training. And I'd say the third thing that we focus on is, of course, it's all about the patient. Promoting patient access to innovative imaging technologies. And that's really where things like focus ultrasound come in, and how can we make sure that that the provider and the patient have access to those innovative technologies. So we advocate for patients by those innovative technologies, get them to market faster. We also work with our customers, our physicians and our hospitals to make sure that there's adequate payment and reimbursement. And then, of course, back to the patient, all about screening, whether it's breast cancer, lung cancer, colon cancer, prostate cancer, making sure that we reduce the barriers that can impede a patient getting that screening test, because the best screening test is the one that's done, and we want it done early, at early diagnosis, so that we can have better patient outcomes.
And can you talk about AdvaMed's partnership with the foundation and how it's helping to advance the adoption of focused ultrasound in medicine?
Well, first we start with a goal and objective, and that goal is to educate the public and policymakers, who are the decision makers, about the innovation of focused ultrasound and how it's beneficial to patients. We also educate them about the barriers to patient access. And then it's about execution. It's primarily about bringing together what AdvaMed does very, very well, and that's advocacy. And then what the foundation also brings is the patients and the science behind focused ultrasound. You have two well-respected organizations coming together with the same goal.
And speaking of industry partners, how does your organization help them and champion them to be able to get their products out to patients more quickly?
Well, we start with a premise around advocacy, and that goal, what we want to accomplish, we approach this as a partnership in what we each bring to the table. And so we approach our advocacy efforts at AdvaMed sort of like a campaign. It's more than just meeting with the agency and lobbying Congress. You know, a lot of people can hire a lobbyist to do all those kinds of things for them. What we bring to the table is a little bit different. We bring a patient element to help tell the story. And so we'll have targeted patient fly-ins, virtual meetings with members of Congress, their senators and their representatives. We'll also do letters to the editor and op-eds. We're, of course, very active in social media, which is where everyone is these days, and Instagram and Facebook, and making sure that we're educating the public. It's really a unique way to do things in Washington, D.C. So it's not just lobbying, but it's also using the patient to tell the story, and it's very effective to do it that way. We have a program called Right Scan, Right Time that has over 30,000 patient emails. These are targeted email alerts and grassroots advocacy that go through Facebook and Instagram. People are writing their members of Congress. And I've always said that advocacy is a contact sport. You really can't sit on the sideline and wait for someone else to do it for you. And this is really a great engagement where you have the advocacy trade association and patients working together towards that same common goal.
You mentioned the fly-in events on Capitol Hill. Can you talk more about that and what those events are, when they happen, and some of the outcomes?
And this is also a unique way in which we do things. We assemble a group of patients. We have providers, so the physicians come down, but then we also have the focused ultrasound companies, and they all come together, and we break out in different groups, but each group has a patient, a provider, and a company to come and meet with their representatives, meet with their senators, and tell their story. And so we make sure each aspect, each stakeholder and perspective is represented at the table. And it really starts with the patient. I always say the patient should be the lead focus, because we have an educational briefing the day before. We bring everyone together. We go over messaging, we go over talking points, do's and don'ts. It's a lot of fun, and we give a lot of confidence to the patients and the advocates, because in the meetings that we have on Capitol Hill, you're typically meeting with your own senator and your own representative. So you're really their boss. And so we make it really comfortable and a fun day for them. They go up to the Capitol Hill on the day itself, and they usually have back-to-back meetings with the lawmakers and sometimes their staff. We're educating them about focused ultrasound, and you're just telling their story. You're talking about how it changed your life. But we also talk about the barriers to accessing these treatments. Members of Congress always want to know what the problem is and how we can solve it. And it's just going in there, telling your story, talking about how focused ultrasound has changed your life, but also talking about that barrier that maybe you had to pay out of pocket, or maybe it was very difficult for you to get coverage for the treatment that you had. It's an exhausting day, but it's a lot of fun. And that's why a lot of the patients, we've been doing the fly-in for a number of years, patients keep coming back and the program keeps growing bigger and bigger and bigger.
That's amazing. We have several patient stories on our own website, and many of them have participated in these fly-in events, and they're just so memorable. Are there any standout moments from past events that you remember?
The most effective one is again for the patient to come in and tell their story to their representative and their senator, because you immediately have their attention. And we had one patient who put together a very short video, maybe 20 or 30-second video that shows, it might be for essential tremors, for example, that shows what their life was like with the essential tremor. And then you immediately take to after the focus ultrasound treatment and how their hand is just steady as anyone else. And they're standing right there in front of you. You see the difference. And it's really compelling to watch that video that's played with the legislative staffer or the member of Congress to see how life-changing something that can do in just 15 or 20-second video is really compelling. And I think that the patients are by far the best advocates for these fly-ins.
Can you share some recent policy wins that have benefited the focus ultrasound field?
Sure. I think those Hill visits, educational campaigns to the FDA and CMS, letters to the editor, we do a lot of op-eds. They've all had an impact in helping support those CMS reimbursement wins. But we're getting very, very close to resolving to what has been probably one of the biggest obstacles to focus ultrasound companies getting their technology to patients, and that's provider reimbursement. The problem is that once FDA determines that a device is safe and effective, it goes over to CMS, and they determine whether the device is reasonable and necessary. And so after that FDA approval, that time between FDA approval and CMS reasonable and necessary determination, devices could wait years before they're actually approved to get into the hands of the provider for the use of the patients. They have to wait through coding and coverage and reimbursement, and it can be a very lengthy and very uncertain process, especially for some of these smaller focus ultrasound companies that are just waiting for that really opportunity to launch their business. So the solution is that once FDA determines the product is safe, to provide the Medicare beneficiary with faster access through these breakthrough medical devices. You could give them 4 or 5 years of payment. That will ensure that people have access to these innovative care products as soon as they're deemed to be safe and effective. And so we're very close to getting a piece of legislation passed. We've met with the White House and members of Congress and CMS. I think we're going to be able to do something either this year, hopefully, or maybe even next year at the latest. But I think we're getting really close on really solving one of the big issues that has plagued the focus ultrasound industry from really starting to take off.
Well, that's so exciting to hear. And are there other advocacy events or initiatives that AdvaMed leads that can help the FUS fields?
Absolutely. I mean, the breakthrough legislation that I talked about has the full weight of AdvaMed, because you have to understand it's not just focus ultrasound, there's artificial intelligence, there's all these different innovative technologies that are coming online that would benefit from breakthrough legislation that we're pushing. So that all benefits focus ultrasound, but all of medtech. Also, our work on tariffs. A lot of these companies, you may not realize it, but a lot of these companies might be international, and the tariffs can be very harmful to them getting their products to market, and the increased cost could be very difficult, make it very hard to get to market. AdvaMed is also engaged in the user fees, which is all the fees that are required at the FDA in order to get your products to approval. And every 5 years, Congress has to reauthorize the medical device user fees, and engaging in that process so that we can get our products approved faster will allow for patients to get access to these products faster. So there's a lot of different things, advocacy efforts that AdvaMed leads and will help support Focus Ultrasound ultimately to be successful.
In your time at AdvaMed, what are some of the accomplishments that you are most proud of?
Well, I mean, I think that there's a lot that come to mind. Medical device tax was also a very important one that we achieved through a lot of different advocacy efforts. But I think it's working with our companies to help them get their products approved through the FDA and to reimbursed, I think is the one thing that we can be very helpful to our members on. Also working with Congress, there's a number of different areas you got to remember. A lot of these companies that we work with Focus Ultrasound are small businesses and help them in keeping their regulation at a minimum when it comes to maybe it's being able to offset some of their taxes and their costs to keep their businesses profitable, but at the same time that allows them to be innovative and making sure that they can invest in R&D, the necessary things to make more innovative technologies that can get to the hands of the provider and the patient so that they can save lives.
Well, this has been a fascinating conversation. Thank you so much. How can listeners get involved, or how can they keep up with your work?
The best thing to do is to join us in our patient advocacy. Our patient advocacy is called Right Scan, Right Time. You can see us, we're sort of at the @ Right Scan, Right Time on Facebook and on Instagram. Join us, be one of the advocates, be one of the people that are out there fighting and talking to your policymakers about the importance of Focus Ultrasound. Join us in this effort because it really does take everyone to help educate and advocate.
Well, thank you again, Patrick, for joining us and sharing all your information coming from DC. We appreciate it.
Thanks for having me.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.